Thank you, Kristen, and good afternoon, everyone. And like Kristen said, thank you very much for taking the time to be with us this afternoon. And the topic that we're going to be covering today is environmental compliance for the healthcare industry. Today, this is me. My name is Jim Alvarez. I'm a senior consultant here in the SME Indianapolis, Indiana office. Been a consultant for a little over 31 years now, and specifically dealing with regulatory compliance issues for about 29 of those. A lot of the compliance regulations came about in the early 90s, some in the late 80s. So I kind of grew up with them and have continued to practice those over the years. A little about me, I've been married to my lovely bride for about 27 years. I am confident that she would certainly say that those are the 7 best years of her life. And I am blessed to be the father of 3 children. 2 are college age, 1 is in 7th grade. So I am currently broke and will likely stay that way for the next 10 years until we get our third young one through college, hopefully. What am I passionate about? I'm passionate about mentoring and giving back to the community. I played soccer growing up when soccer wasn't popular in the United States, and began coaching soccer in the early 2000s before even my kids started playing. I got the itch. So I've been coaching for about the last 18 years, and currently I coach a travel team that my youngest son plays on, and I'm also an assistant coach at a local high school. And we are currently in the state tournament. We won our sectional last weekend and we play regionals this weekend. So excited to continue on the track towards hopefully a state championship. Now I'll turn it over to Jeff. Let him introduce himself.
Thanks, Jim. Hi, my name is Jeff Lanier. I'm a senior consultant at SME. I've actually been with SME for the last 24 years since graduating Michigan State University. Go Green. And I've taken on 2 primary roles at SME. The first is brownfield redevelopment consultant and managing complicated projects. And the other is leading our stormwater compliance team. And so with that, you can imagine I've got a variety of experience here at SME. And in regard to stormwater compliance, I've actually worked on a number of healthcare facilities. I've worked on industrial sites, prisons, school districts, you name it. So I'd be happy to share some of those experiences with you. And from a personal standpoint, like Jim, I'm also married with children. I've got a 12-year-old son and a 14-year-old daughter. Things are crazy right now with sports and travel sports and virtual schooling and raising a puppy. So I'm the lead coordinator at our house right now, which is chaotic. And if I do have some free time, I really love to travel, collect wine, and mountain bike. And I think I told Jim this the other day. I just had 2 nasty crashes on Sunday, so I may be updating the slide with a new hobby. So that's it for me. And please, if you hear something that you're not too sure about or you want to ask questions, please chime in. Hopefully this can be interactive.
Awesome, Jeff. Thank you. And yeah, as you're telling me about your mountain biking incidents, and I see the other thing here that you'd like to collect wine, I certainly hope that you like to imbibe in a little bit of wine as well to kind of soothe the bumps and bruises when you fall.
Yes, so the wine comes after the biking.
Awesome. All right, thank you. Yep. Well, moving on. Having worked with healthcare facilities, hospitals, and a variety of healthcare buildings or clients over the years, when I talk compliance with those clients, environmental compliance is typically not the first thing that comes out of their mouth. And, typically it is compliance with Joint Commission requirements and compliance with the State Board of Health. And we tend to start talking about environmental compliance kind of third on that. And when we're talking about the Joint Commission, any of you here that are with healthcare facilities, you certainly understand that, that's anything to do that impacts patient care. That's emergency preparedness, and those regulations are governed by the Centers for Medicare and Medicaid Services. Infection control, which obviously has been huge this year with COVID-19 and everything that goes with that. Fire and life safety, medical gas and vacuum systems, and heating, ventilation, and air conditioning. and utilities maintenance. So, in that list there's nothing really specific to environmental, but environmental regulations do overlap with those in there. And really, our agenda today, I think, is pretty simple. We're going to provide I call it 1,000-foot overview of some of the, typical or routine environmental compliance issues that affect healthcare facilities. You typically hear 10,000 foot, but at my age, my eyes are bad, so I have to really drop down a bit and get to 1,000 foot or 1,000 feet. We'll also, from time to time, share our insight from working at healthcare facilities and provide some, guidance or, what we've seen work for us and our clients in compliance management. And, it says here pitfalls that we've seen, and maybe a better word would be to say opportunities where our clients can improve on environmental compliance. And then certainly, as Kristen said at the beginning, feel free to chime in, raise a hand. We'd like this to be interactive, so if you have questions along the way, feel free. Environmental regulations are, established by different acts that have been promulgated over the years. Specific to most industries, and including healthcare, you have the Clean Air Act, the Clean Water Act, and those speak for themselves. You have the Resource Conservation and Recovery Act, which is RCRA, and that is all things waste. We have the Comprehensive Environmental Response and Compensation and Liability Act, CERCLA. Another name for that is Superfund, but realistically, that doesn't affect too many hospitals, although it can. But you'll hear another term a little bit later on called EPCRA that falls under CERCLA. Then we have the Toxic Substance and Control Act, which is TSCA, and the Federal Insecticide, Fungicide, and Rodenticide Act, which is FIFRA. And FIFRA also, as we'll talk about a little bit later, has taken a little bit more of a importance with sterilants and disinfectants as a result of extra cleaning that has had to been performed at facilities as a result of COVID-19. So jumping right in, the first kind of set of regulations we're going to look at are under the Clean Air Act. And as the name implies, it is the regulation that oversees or regulates air emissions. Air emissions are there are two sets of pollutants: criteria air pollutants, which there are 6 of them, and hazardous air pollutants. And there are 187 specific hazardous air pollutants that are covered under that rule, or covered under the air emission regulations. Some of the typical emission sources that we see at healthcare facilities, and whether it's a hospital or a senior assisted living or a medical office, typical ones are boilers, medical waste incinerators if you are a large facility, backup power or emergency generators, fueling operations, and refrigeration units. So the first step in compliance under the Clean Air Act is really to determine what type of permit applies to your facility, or if you even need a permit. Permits are based on potential emissions. So potential to emit is a term that you'll probably hear or have heard. And that's how you base what your emission permitting level is. So if you're a major, the largest permit you would have would be a major source or Title V permit. So your potential emissions would be above 100 tons per year for any of the criteria pollutants. And the hazardous air pollutants, it is 2.5 tons per year, or any combination thereof that exceeds 10 tons per year. So first of all, determine your permit level. And there are different levels here like we're talking about, or up here on the screen. We have the next level down, which is the federally enforceable state operating permit, or FESOP, also called a synthetic minor. So that is a type of permit where your potential emissions exceed the major source thresholds, but because you're willing to take certain restrictions, whether it's hours of operation for example, of a emergency backup generator, fuel usage, diesel fuel and or natural gas, you're able to stay below the major source emission levels. So the state and federal EPA allows you to maintain a fee stop, very similar type of permit, but not quite as restrictive, and not quite I would say on the back end requirements. And then there are different levels moving forward, all the way down to exemption status. So the weird thing about air permits and air regulations is even if you are not required to have a permit, if you're exempt from having a permit, there are still federal requirements that can apply to you. And you, for example, new source performance standards, NSPS, that applies to boilers and incinerators. You have the national emission standards for hazardous air pollutants, NESHAPs, the quintuple D or 5D, and the quadruple Z or 4Z. The quintuple D covers industrial, commercial, and institutional boilers and process heaters. And the quadruple Z covers stationary, reciprocating, internal combustion engines. A lot of words to say there. But those are basically engines that are in your backup generators or emergency generators. And then we also have the hospital medical infectious waste incinerator rule, which covers acid gases like HCl, dioxins and furans, and metals, lead, cadmium, and mercury, that can come off of an incinerator because of the high temperature. Now you've got your permit. You've determined what applies to your facility. What comes next? Now what I call a true compliance begins. The permit just allows you to operate. So where the rubber meets the road is really reviewing and getting to know the terms and conditions in the permit, both facility-wide and on an emission source specific level. Oftentimes you're required to prepare certain documents or plans, which could include a preventative maintenance plan or a assurance monitoring plan, for example. Skim through the permit, see if there are any documents you need to prepare or plans. And then you'll want to do and set up routine monitoring and record keeping requirements, and then start doing your reporting, which most air permits have quarterly, semi-annual, or annual reports that they're required to submit. And then last but not least, if you make changes, you'll have to submit a permit amendment to the state regulatory agency. And most permits last 5 to 10 years. So at that point, they'll be up for renewal, and there are certain timeframes that you need to submit your renewal application. I do also want to quickly note that there is a lifetime operating permit here in the state of Indiana that, as long as you comply with the terms in that
healthcare facility in regard to stormwater and waste charges. The first is the Clean Water Act, which Jim mentioned. You've probably heard of this. It was passed in '72, and this really just established the framework for regulating the discharges of waters to the United States. And under that, in 1999, this NPDES process, it's the National Pollutant Discharge Elimination System. It's a mouthful. But this NPDES process was created. This is the regulation for controlling stormwater discharges to the state. And you've heard many different terms for NPDES permits. You've probably heard the general permit, a stormwater permit, an individual permit, an MS4 permit. This all falls under this framework of regulation. And I'll be talking about how this pertains to the healthcare industry. And then the other regulation I want to touch on was the Oil Pollution Prevention Act, 40 CFR 112. This is actually, people know it as SPCC plans, or the rule. And this was enacted to protect waters of the U.S. from large oil releases, petroleum releases. So I'll actually go from the 10,000 foot perspective when we're talking about healthcare facilities and their stormwater and wastewater discharge. Because as you go through this evaluation process and you're trying to determine what type of regulations apply to your facility, it's a pretty basic evaluation step. It's looking at your facility drainage. It's looking at where you store chemicals, what your potential pollutants are, and then what regulations will apply to my facility. And as you do this, you want to focus on two general discharge types, and it's pretty basic. The stormwater. This is obviously the discharge of pollutants in stormwater off-site to the waters of the state. And the other is wastewater, and this is usually indoor drainage. This is discharge of pollutants in wastewater to the sanitary sewer system, which then goes to the wastewater treatment plant and then eventually to the waters of the state. So let's start with stormwater discharges at your facility and NPDES permits. And I've listed just kind of the 4 steps to this evaluation process. And the first and the most important is just understanding your stormwater collection system at your facility, understanding where your drains are, where your outfalls are. Do your stormwater outfalls, do you drain the water off-site? Does it go into a underground stormwater system? Does it go into a detention or retention basin, and then possibly through an overflow system off-site? So you need to understand if your stormwater is leaving the site, and then if so, what receiving body or sewer system does it connect to? Once you determine that it does leave the property, then the next step is just looking at your chemical storage and usage at your site and understanding all the potential pollutants that you may have at your facility. And I realize some medical facilities, some healthcare facilities do not have a lot of pollutants. For instance, smaller medical office buildings typically don't have a lot of pollutants at their facility, but the larger emergency healthcare hospitals do. They may have their own fleet vehicles. They may have their own fueling, maintenance garages, laboratories. Let me see if I can go forward here. And I just want to show you some pictures of some more well-known or unknown potential polluting sources. The top left is a hydraulic compaction dumpster with some leaks. And you can see that it's not covered, so it's exposed to stormwater. The top right, it's actually a very large salt storage area. It's partially covered. I realize that most healthcare facilities don't have this large of a salt storage on site. However, salt is one of the #1 pollutants in stormwater at most facilities. And then bottom left, you can see a fueling station. It happens to be a semi truck. I was looking for one with an ambulance or fleet vehicles, but I couldn't find one. So there's an obvious polluting source. And then bottom right is a smaller generator, backup generator, and a AST or above ground storage tank with fuel in it. So those are some common potential polluting sources that you may have at your healthcare facility. And then going back to the evaluation process, you've looked at your stormwater outfall. You've then looked at potential polluting sources. Now the next step is applying for coverage for a stormwater discharge permit, an NPDES permit. And that process is known as you have to submit a notice of intent. And I left myself a note here, just a comment that you may want to review your standard industrial classification code. This is the code that your facility is registered under with the government for tax purposes and economic tracking purposes. And the reason I bring it up is because only certain SIC codes apply to NPDES permitting. And there's some gray areas with some of the categories. So you may be able to get out of this if you talk to your local agency to see if you actually qualify for NPDES or you can back out of it. But let's say you go forward and it's determined you do need to get a permit. You just really need to understand what that entails and what you're signing yourself up for, so to speak. You are definitely going to have to prepare a stormwater pollution prevention plan. And a misnomer is everyone believes that once you apply for a permit, you can then do your stormwater plan. after the fact, and actually you need to do it before you apply. So you put together a stormwater pollution prevention plan, and it'll lay out all the requirements for your facility to sample stormwater, to do your visual assessments, housekeeping, employee training. So it's a pretty detailed plan that will be required as part of your permit. And I have a note here about other alternatives to getting a permit. There are ways to possibly avoid getting a permit. There's some tricks to the trade out there. And one is installing engineering controls at your facility. For instance, covering a hydraulic compaction dumpster. If that's your only source of contamination, possible contamination in stormwater, then cover it. Or look at how your water is draining your property, see if you can keep it on site by managing it differently. So there's different ways to getting around it. You can also apply for a no exposure certification. So just some tricks to the trade. So moving from stormwater to wastewater discharges, these are your discharges typically inside your building to your sanitary system. And if you're going to go through this evaluation process and you haven't been contacted yet by your local wastewater treatment plant, you probably will. You do need to understand their discharge requirements for your effluent, what those limits are. So you'll go through a pretty comprehensive evaluation of all chemicals that are discharged into your sanitary system, laboratory, cleaning, janitorial, fuel, whatever it is. You'll have to go through that entire list. You'll have to do some sampling, and then you apply. You apply with your local wastewater treatment plant for a permit. Once they've gone through that evaluation, they will issue you a permit, and it'll lay out exactly how you are going to continue to sample your wastewater effluent, how often you need to report that back to the wastewater treatment plant. So that's a relatively simple process, but it's something that's often forgotten about. And then lastly, the SPCC regulations for stormwater. As I mentioned before, this is related to petroleum only. So for those facilities that do have these large backup generators with 2,000, 5,000 gallon diesel fuel storage on site, you do need to look at this regulation and determine if your facility will need to prepare an SPCC plan. And it's criteria for SPCC. You need to look at your total aggregate petroleum storage. If you have 1,320 gallons or more of petroleum stored in above ground tanks, and I put a little asterisk there, EPA will only consider for this threshold 55 gallon or greater containers. So if you happen to have 1,005 gallon containers of petroleum, that doesn't count. It's just 55 gallons or greater size containers for above ground. And then below ground is 42,000 gallons or more of petroleum. And then, so if you do meet that threshold and you have stormwater that discharges to navigable waters of the state, then you need to prepare a SPCC plan and have it certified by a professional engineer. So those are the three regulations I kind of want to go through today. Jim, I'll turn it back over to you.
Thank you, Jeff. Hey, real quick, back to the SPCC rules. That regulation is based on capacity, correct? Not necessarily the amount of oil you have on site, but the actual capacity of the containers, correct?
That's correct. So if you happen to have a 2,000 gallon AST, but you only fill it 50% of the way, and you rarely ever fill it more than 50%, it doesn't matter. It's still considered a 2,000 gallon.
Yep, thanks. I know that's confusing at times to some folks.
Yeah. Good point.
So thank you, Jeff. And so now we're going to move on to some additional environmental regulations. Next up is the Resource Conservation and Recovery Act, otherwise known as RCRA. And RCRA regulates all things waste, everything transportation, storage, and disposal, and including generation. A term that's really important to understand here is RCRA regulates cradle to grave. So once you generate the waste, all the way from transportation to disposal, that waste is yours forever. Unless you happen to have a pretty solid contract with the transportation or disposal facility that they are taking liability for that waste, that is always your waste. So it's always very important to make sure that you have good documentation under these regulations. What are some common waste streams that we see? at healthcare facilities. We have office and cafeteria waste. So typical office waste might be printer ink, typical just normal everyday trash and refuse. Cafeteria waste would again be paper, refuse, and then also grease. Also included in this our common waste stream would be medical waste, electronic waste, which could be everything from computer screens to laptops to tablets to cell phones, anything electronic that you dispose of. Most states now have what's called an e-waste requirement under RCRA. Maintenance waste, common maintenance wastes are used oils. So, especially if you have an SPCC plan, this is one of those regulations that crosses over. Used oils are covered under an SPCC plan, as well as it could be covered under RCRA. So other typical maintenance wastes could be paints, could be aerosol cans, especially if you have a maintenance facility or maintenance shed on site, anything that's stored and done and performed in there, the waste, you're going to have to manage that accordingly. And then universal wastes. And universal wastes are a special set of wastes that historically had been classified as hazardous. However, due to opportunities to recycle as opposed to dispose, EPA and the states have pretty much followed through, allows you to manage these as universal wastes. So they don't count against you or count as a hazardous waste at your site. And common universal waste streams are spent fluorescent light bulbs. And I know a lot of facilities are going through the process now of moving away from the fluorescent light bulbs to LED, just they last longer, and well, you don't have to manage them as the same type of waste. Batteries, everything from alkaline to lithium batteries, NiCad and cell phones, and also acid lead batteries in maintenance equipment, forklifts if you have, or low boys if you have any of those at your site. And then some states also allow electronics to be managed as universal waste. Some states do have a specific e-waste program, which is over and above the universal waste rules. So just make sure that you're complying with both or either or, depending on your situation. And even though it's generally not a waste, underground storage tanks fall under RCRA as well. So the first step in compliance with the hazardous waste rules is to look at what level of generator are you. So what is your generator status? And there are three. If you do generate hazardous waste, there's large quantity generator, small quantity generator, and very small quantity generator. The very small quantity generator status used to be called the conditionally exempt generator status. That came about, I believe it was 2019 when EPA came out with those rules. Don't quote me, it's either 18 or 19. Not all states, especially if the state has management authority over their waste rules, not all states have adopted the very small quantity generator status, because there are a few nuances that are different. So again, depending on which state you're in, just make sure that you review that accordingly. So once you've developed and determined what your generator level is, depending on the level, whether you're a large quantity or small quantity, typically you would be required to develop certain plans, which may be a waste minimization plan or a contingency plan in the event that you have a release of hazardous waste. Make sure that you're training your employees. Since RCRA is regulated cradle to grave, maintaining disposal records is critical and should be a priority. Conduct routine inspections of your waste storage areas and your waste generating areas to see how you can minimize some of the waste generation to begin with. And then if while you're doing inspections, if you see deficiencies, correct those deficiencies and document those corrections. From personal experience and working with several clients, If you do get inspected by a state or federal regulator, if they see that you've identified your own issues and have corrected those, really goes well during an inspection, and can sometimes be the difference between just getting a kind of a verbal warning versus an actual written notice of deficiency or a violation. Next, we'll move on to CERCLA. That's a lot to talk about, the name up there, so I'm just going to call it CERCLA. And again, generally under CERCLA, we're talking about the emergency planning and community right to know portion of CERCLA, which deals with hazardous substances and toxic chemicals. And those are two distinct classes, we'll call it. So under hazardous substance and extremely hazardous substances, there's what's called Tier 2 reporting. And that deals with, or is what the amount of hazardous substances you're storing on site. Whereas the toxic chemical is a toxic chemical release inventory called TRI or Form R. It is what you've manufactured, processed, or otherwise used. Since hospitals are typically not manufacturing facilities, there's not a lot of healthcare facilities that are required to submit TRI reports. So it's important that you determine whether or not the toxic chemical release inventory does apply to you. So kind of sticking with what we know is going to apply, the Tier 2 reporting. Tier 2 reports are due March 1st each calendar year, and that is for what you stored, the hazardous substances or extremely hazardous substances that you stored on your facility the prior year. So anything that you stored for one day here in 2020, you'd have to report prior to March 1st of 2021. So the first step is inventorying all the hazardous substances that you have on site and seeing which of those exceed a threshold planning quantity. It is important to know, for hazardous, most hazardous substances have a threshold planning quantity of 10,000 pounds or more. And whereas the extremely hazardous substances can have a threshold planning quantity of anywhere from 100 to 500 pounds, and could even be 1,000 pounds. So make sure that you identify whether or not you're dealing with a hazardous or extremely hazardous substance. And though I don't have it up here, you can find what those are in a good reference for that is called the list of lists. So you generate that report, and the reports are generally submitted electronically to the State Emergency Response Commission and the local Emergency Planning Committee. The third place that you submit the report is the local fire department. A lot of states don't have the electronic submittal to the local fire department because there are so many of those, and which particular fire department is closest to your facility. So I always recommend that you print out a copy of the report and submit that to the local fire department as well. And the Tier 2 reports consist of the report themselves, which lists the specific substance, the quantity that you stored on site, the total amount that you stored on site over the entire year, the hazards associated with that particular substance, and then you also include a site map, which identifies where the materials were stored on site, along with the safety data sheets that give additional information. So common chemicals that we see reported, or common substances, I should say, that we see reported under Tier 2 are diesel fuel, gasoline, and sulfuric acid. Sulfuric acid comes in from lead acid batteries, typically from maintenance equipment, and also from backup servers that are we've seen several of those in hospitals to back up the electronic data, patient information and medical information. And again, TRI reporting is generally not required. The next up is TSCA. So under TSCA, it authorized EPA to issue rules and establish regulations that restrict manufacturing, processing, distribution, and commerce, use, and disposal of certain chemicals. That's a lot of words there. I think for most healthcare facilities, TSCA is going to apply to really older facilities. that have lead-based paint issues or have had potential areas with lead-based paint, PCBs, and asbestos. So those are the three primary substances that are regulated under TSCA. So we talked about PCBs. So PCB equipment could be a transformer or capacitor. Depending on the age of your facility, I have also seen where PCBs have been present in hydraulic oil that has been used in elevator shafts or elevator lifts. So again, depending on the age, you may want to verify that. Under asbestos, you're looking for spray-on and other type of what they call cementatious insulations, and then ceiling tiles and floor tiles. And most of those, whether it's a lead-based paint, whether it's asbestos, or whether it's PCBs, have been phased out over time. So if you're a newer hospital, a newer facility, you probably don't have to worry about that. But if you're an older facility, specifically if you've been around since the 70s or even early 80s, you're going to want to make sure that you've conducted assessments to identify and see whether or not you have these materials on site, and then maintain an inventory. And typically they come, you probably have a management plan as far as how you work in the area, or if you do any type of demolition or work in the area that requires removal of those materials, how you're managing and disposing of those materials. So lastly, we're going to go through FIFRA. So instead of me reading that whole thing there, but FIFRA, along with, I think the name implies pest control, it also covers a wide variety of sterilants, disinfectants, and sanitizers. So again, that's very important. This year has really been, an odd year with, we'll just say, with COVID, and the disinfecting requirements have gone through the roof. And it basically, for lack of a better term, it's disinfecting and sterilizing on steroids. So those are covered under FIFRA. But basically under FIFRA, it just says use your products, follow the instructions that are in the SDSs and also on the labels. So if the label indicates you should wear, specific personal protective equipment, well, don't get it on your eyes, don't get it on your skin, don't get it on your other mucous membranes, nose as well. The equipment that you use to apply the particular chemical, and pesticide storage areas and containers. And again, make sure that you understand the labels or understand what you're dealing with. My wife is an RN, and I think she had mentioned that they use a material in her surgery center called Cavicide, which is, it's a disinfectant wipe, but it pretty much says it's extremely toxic and can cause health issues, serious health issues. I believe one of them, she even said, is known to, cause cancer in lab rats. So, make sure you're following the instructions on how to use all these materials. So the records that you should maintain, any pesticide purchases, pesticide application records, pest control program, if you have a written program, certification status of pesticide applicators, and pesticide disposal records, and again, and any manifests or bill of ladings that go with that. I know a lot of facilities will contract pest control out, so make sure that the contractors that you're using are following the guidelines as well, and they have a specific program that they're following, and they allow you access for records, and they're keeping certification for their employees. And lastly, FIFRA can also cover requirements for ventilation hoods if you're doing any type of mixing of sterilants or disinfectants, making sure that you have proper ventilation in the area. So that's it. Those are all the regulations, or I shouldn't say all the regulations that you're required to comply with on the environmental side of healthcare facilities. But those are what we see on a routine basis when we're working at them. So in summary, as we talked about, there are several environmental regulations that can apply, and it can be very overwhelming. So, start from, from the, for lack of a better term, from the beginning, and work your way through, and make sure that you are working with professionals or working with people or your staff that are responsible for managing compliance, understand what they're doing. I think by far the most complicated regulations are the air emission, under the Clean Air Act. Again, if you don't have a permit, but you still have to follow certain requirements and submit certain reports to federal and state agencies, that can be complicated. All of these regulations really are focused around chemical usage and management. Important to remember that all wastes are managed cradle to grave. That's very important. And I would say it is, once you have your permits, once you have your plans in place, develop and maintain a robust document retention and control procedure. Some permits, some programs have those outlined in the regulations. Typically, it's 5 years, but make sure that you follow that, and make sure that it jives with your particular company's record retention policy. And then also very important to train your employees. Those that are working in these areas need to know what they're doing, and if there are things that they need to be inspecting, that they need to be following, wearing particular PPE around certain items, make sure that they know how to do that and do that effectively. So with that, a big thank you. I appreciate you guys taking your time. And Jeff, is there anything that you want to close out with here?
No, I thought you did a really good job. I don't have anything to add. Hopefully we can get some questions from some of the participants.
There's a question. What is the most common compliance violation in regard to NPDES permits or SPCC plans?
Most common violation, I would say documentation, because when sites are audited, especially SWIP permits, the regulators come to the site and they immediately ask for documentation that the permit holder is in compliance. And the most common violation there is they do not, even though they are inspecting and doing their quarterly inspections at their facility, and they may have staff that are routinely doing that as part of their day-to-day operations and walking around the facility, they're not documenting it and keeping it in a file that the regulators can easily find. So I would say that is probably the most common violation, is just lack of documentation of completed activities.
I agree with you, Jeff. I think a second one that I've seen here recently actually is also training and documentation. The training under that rule, I believe, is annual, and it's just on the awareness level, but a lot of times it slips through the crack. And if you can't show a regulator your training program along with the people who have gone through it, that raises a red flag as well.
All right, well done, guys. Very great presentation. Thanks to all the attendees who joined us today. If you're interested in a CEU certificate, please email kristen.zerlag@sme-usa.com. It's on the screen right now. So go ahead and do that. We hope to see you at our next session of our healthcare webinar series. We have Tony Thomas presenting on pedestrians and parking lots in about 15 minutes. So we hope to see you there. Thank you, guys.
Thanks everyone.
Shannon. Great job, Jeff. Thank you.
See ya.